Good day. This is Russell Hendrickson with Practical Data Solutions, or PDS as we're known. Thank you for joining us today. And today's webinar is on denials management through analytics and dashboarding. With that, if you're not familiar with PDS, we've been in business since 1995. So for over 20 years, we've been working with healthcare organizations to design and implement best practice technology for data warehousing, business intelligence, analytics, dashboards, reporting. I like to say we were working with analytics before the IT community came out with the term analytics. Our goal, of course, is to make it easy to work with information rather than working to get information. So with that, I'm going to give a little intro here. Today the technology continues to get more and more powerful. This analytics technology is, made it such that literally, tools have gotten very visual. They're very easy to use. Just about anybody who can click a mouse now can literally slice and dice through data, make changes on the screen in seconds, look and see a lot of different visualization, what's going on with data, and even literally, dig into data, slice and dice through hundreds of millions of rows, charges and payments and denials, and they can literally do that in seconds without anything. Things that couldn't be done even 5 years ago today have just gotten so easy, where people can slice and dice through data and literally drill all the way down to what's going on with denials and looking at denial rates. One of the biggest challenges, though, with this technology is that, you take a subject like rejections or denials. There's so many different factors that impact what's going on, and the organization can impact from the front end where we're collecting information to the back end, that even though I have lots of information at my fingertips, how do we make sense of it? How do we focus all of those different dimensions, all of those different metrics, so that, one, we can manage around it, two, we can manage effectively, and three, how do we communicate that out to the various users, the stakeholders, the people that really need to understand, what they're doing and the impact on the organization and ultimately on the collection and the revenue of the organization as a whole. And that really is the goal for today's topic. And with that, I'd like to introduce Scott Everitt. Scott Everitt has been working with decision support technology for more than 15 years. He's been with PDS here for almost 9 years now and is a key driver at PDS with not only helping organizations go live and bring technology in during implementation, but making sure it's not enough to have the tools or have access to the data. How do we apply the data to make it effective? And with that, I'm going to turn it over to you, Scott.
Thanks, Russ. I appreciate the introduction, and I appreciate everybody here taking the time out of their day to talk about what's really kind of becoming a lost art in revenue cycle management. Now, denials obviously has been a critical piece of the revenue cycle forever, and it still continues to be that way, but there's so many other things going on in healthcare. There's value-based reimbursement, there's changes to compensation plans, and people just running all over trying to figure out what needs to be their priority. But the fact of the matter is denials needs to be a huge priority because there's a big cost to it. Think of it this way: what would you do if you found out that your front desk staff was just losing $30 from every 10 patients that they see? Or if your commercial payers just came up to you one day and said, you know what, 20% of the work you do from now on for us is going to be for free. And the reason I asked what your reaction would be is because, you know what, that's what's going on right now, and that's what we're seeing when we engage with clients regarding denials management, is a lot of times there are things going on within the organization which are costing them quite a bit of money. And there really is a fairly significant cost to it. Industry benchmarks will say that denial rework can cost you anywhere from $24 to $35, and it's not just a cost factor there, but there's a timeliness to collection factor as well. And really by the end of the cycle, you're maybe 5 months out and collecting and having your claims that are denied fully adjudicated. And that's a big deal when you consider the other timelines that are out there. Look at it this way. You can submit a clean claim and it gets paid 30 to 45 days, and you get your money right there. But when it gets denied, you have to take and find all of the information that's required to appeal it, do everything that needs to be done to resubmit the claim. The payer sits on the claim for a while as well. And really, by the end of the day, if you're over 143 days, a $100 claim is almost worth to you than the cost that it takes to actually collect it. And so that's why we really want to, denials, because you're not just killing your payment rates, you're killing trees as well, because you have to go through and create all of these paper and additional statistics that are out there. It's a big problem, and it's really driving what's going on in the revenue cycle with our payers, and there are huge opportunities for return on investment that's out there. Well, why are we doing this to ourselves? Why do we allow this sort of thing to happen? And the questions that we ask our clients, a lot of what we hear back is we don't have enough staff, we don't have control over what our payers do anyway, and the information that we're getting really isn't that great. We don't have a lot of feedback on what's going on after the denial. The charges are always duplicated because of the multiple denials. And you know what? Denials reporting, but it's something that's absolutely critical as well, because knowledge is power in this undertaking. There's a lot of money at stake, and we need to really understand what are the things that we're doing to cause these denial rates to. What are denials that are maybe getting paid at higher rates than others? What are denials that are not getting paid at all? And what's the overall financial impact that's out there? We can go in and look at it from a strategic standpoint and say, for effective management, there are really two scenarios that we need to have actionable information in the hands of people who have the ability to make a difference. The first one is a short-term urgent situation. What are things that we need to notice right away, need to be addressed right away? Time is of the essence. If we find these, we can correct them and get them paid, but we need to know right away. The second scenario that's out there are what are some longer-term, maybe strategic initiatives that we can implement within our organization to drive down the denial rates as a whole? What are things that maybe we're doing that we can change? What are things that we can implement technology or processes which will make things better overall? And so looking at that, then we can better understand what we need to do first. So let's look at these short-term urgent situations that are out there. What is it that we need to know? Well, we need to know what's being denied. We need to know how much is being denied. We need to know why are our claims being denied, and is this normal or is it abnormal? So we can go into an analytics system, and most of our clients have analytical systems that allow them to go in, whether it's via their payment system itself or whether it's via some sort of third-party software that's out there that allow them to go in and run kind of a detailed level report with prompts that get you down in what we like to call bottom-up reporting. So you can look at this, you can apply filters, you can apply other variables that are out there and get kind of a better look at what's going on. But is this really the sort of reporting that is going to help you in determining what you need to know right away? Is this going to help you identify trends and spikes? So what we want to look at in order to determine what needs to be done right away is we utilize what we call internal benchmarking. Internal benchmarking is just benchmarking against yourself from a different time period. You can use the last month, you can use last year, you can use the average of a rolling 12 months. And what we're looking for is we're looking for spikes. We're looking for abnormal activity that occurs during a month or a 2-month period, something where it's out of the ordinary. And it may be at a department or location level or a payer level. We don't know, but that's what our analytical system can help us with. So if we go into an analytical report, what this allows us to do is more from a top-down standpoint, where what we're trying to look at is summarized data, and we're just looking at key trends. So a report like this, we can go in and we can analyze and look right away and see immediately there was a spike in January. We can then put a filter on January. We can go through and we can say, was this a particular payer that was causing the issue? Or we can see right away, look, Blue Shield caused the bulk of that issue, and then we can add additional variables to see what's going on. We can add like a denial type and say, oh, look, right there, that very first denial type that's there is causing the bulk of the spike to hit. Identifying that spike is going to be the key to correcting it, and of course, we can then go through and drill clear to the detail level to see which patients, which invoices led to these denials. And it's something that we can address either internally or with our payers to begin to resolve those right away. Again, in these immediate management scenarios, identifying the problem quickly and getting it resolved is the key, because a lot of times you can work with your payers in order to do that, to get the claims reprocessed and get paid more quickly than you otherwise normally would be for a denied claim. Now, as we've gone through this, we've found sometimes there are some fairly common causes for these spikes that you'll see out there. A lot of times if you've updated your billing system or your clearinghouse, things may be a little different than what your payers are used to seeing, and so you'll have to communicate with them. If you bring on acquisitions of new practices or new providers and need to get them enrolled under your tax ID number, that can cause spikes as they occur. If you change processes, or a lot of times they can be system issues on the payer side which cause these as well. So that's immediate management. Now, I know, Russ, you had a question about utilizing analytics as far as being a little bit more strategic.
Yeah, and I think that was a great, intro, and we've showed some of the different business intelligence tools. The idea is most people typically do have a good set of analytics that front ends their denials data. They can look at, payments and adjustments and then see what's been denied. One of the focuses, Scott, and I think you've shown, and we've shown a few of those things, but can you talk about how dashboards might be, play a factor in this, and how can we use dashboards to better focus our overall? So can you talk to that as the next topic, please?
Absolutely, Russ. And really, dashboarding is critical. I know a lot of the reports that we've just gone through there, those analytical reports are great, and it's great to have that power at your fingertips, but we also know that managers are 100 different directions at one time, and a lot of times what they really prefer from a dashboarding standpoint is having a lot of information right at their fingertips, multiple reports where they can look and identify key indicators that are out there that may need some focus. They can look at key trends, key benchmark statistics that will help them to see what needs to be addressed immediately, what is something that we can implement from our longer-term strategies as well. So when we look at a dashboard like this, you can see there are multiple pieces of information and key indicators that are available. Well, once we have that and we can look at strategy a little bit, we can create another dashboard or type of dashboard which allows us to maybe look at a more focused level. So we can create a dashboard that maybe allows us to look at what are our common sources of denials that are out there. We can look at the cumulative time it takes to collect our denied charges, or what are our payment rates comparisons. Issues that we've identified that are causing problems within our practice. And these are things that we can utilize to really help us form a strategy. Once we have those out there, we know what's going on, and now we need to communicate them to our key stakeholders that are out there. So we can move on to a different type of dashboard that really focuses on communication. Now, this is something that allows us to get information into the hands of a much broader audience that's out there. This is something that we could give to board members or to practice managers, which gives them information at a glance of some key trends like you see in that top section there, where we're comparing this month to last month of some key denial indicators. It allows us to look at common questions that are part of our organization's strategy and see where we're hitting our target and where maybe we're not hitting our targets, or where we're underperforming and where some attention is required. We can look at trends where, with like our clean claim rate, or we can look at other trends where you can see that spike that we identified in our analytical system earlier. These are dashboards which can help communicate and provide information to other key stakeholders who may have the ability or empowered to go in and take action on these. Now, not all of these may apply, and they may not know if they apply. There's ability to put in their explanations of what we're measuring, or if they're looking at it and they really want to dive in, then they have the ability then to link back into the analytical system where, once again, that slice and dice and drill capability is available to them. So once we have these dashboards in place and we're communicating out, we can get more of a strategic management that's out there. We can identify what are the key problem areas in our organization. And PDS has 100 clients, and if I went in there, we're going to have 100 different key problem areas. But what we want to do is identify the biggest. Is it something that's a particular denial code or a payer that's causing it? Is it a department that's causing it? And really, we want to understand not just what our volumes are, but we need to know what's going on after the denial occurs. So this allows us to create kind of what we call a management perspective on denial. Now, analytics that are out there allows us to look at maybe some key measures that are more difficult to get out of, say, canned billing and system reports, or just counting denial volumes that are out there. It allows us to look at things like matching denied charges to a resolution that occurred to them, or categorization our follow-up efforts, or looking at our appeal efficiencies, or what is the current status of our denied claims, what's sitting out there, what's pending. So we can look at that, and we can take this after the denial information, and we can look at potential resolutions that are out there, possibilities of what can occur after the denial. And we've really kind of broken it down into 4 different areas where when you have a denied charge, you can get a payment on that charge after the denial. You can write it off or adjust it off after the denial. You may shift it to your patient responsibility, or it could still be pending and sitting in your AR waiting to be worked, waiting to obtain more documentation, waiting to obtain the right information that you need in order to appeal it or send it back to the payer. Well, once we know these information, then we're going to move into a different type of dashboard where we really want to look at the ability of a dashboard to tell a story. So in this dashboard here that you can see, we can look at what's going on over a 6-month period plus our year-to-date. And in here what we're doing is we've organized the information to really understand, here are our total charges. Fiscal year-to-date, we've had $225 million in charges. 41 million of those charges have been denied. So that's about an 18% denial rate. Well, we have an 85% clean claim rate. That's decent, but it can get better. And so what are the things that we want to focus on in order to do that? Well, we can look at what's been paid after the denial and see that it's really only about 4% that's been paid, or 1.6 million. We can see that we've adjusted off about 5 million, so that's about 7 million that has been what we like to call resolved on our side. Well, that means that there's a lot of unresolved denied charges that are sitting out there. In fact, it's about 82% of our total denied charges. And the ones that have had no activity on them, no transactional activity whatsoever, is about 43%. And we think that there's an opportunity out there to really focus in on those and find ways to determine what will get us the most money for the effort that we can provide for it. So we can then look at other reports that may be there to look at what are the most common denial types that are likely to be paid upon appeal. Or we can look at, well, who are the payers who are more likely to pay, and who are the payers that rarely, if ever, pay upon appeal. We can look at all kinds of different time factors as well, because again, it's not just about the money and the rework cost, it's about getting paid in a timely fashion. And which are the denial codes and which are the payers that require more time in order to get paid once we do get paid upon the appeal. So having all of this information gives us the ability to formulate a really good strategy that's out there and focus our efforts to get the most likely payment that we can. So what are we going to look at? Well, we're going to look at strategic denials management and understand what in our organization, what do we do that is controllable, okay? And a lot of people don't think denials is controllable, but there's a lot that can be done, especially within your organization itself. Things that are controllable within your organization are things like registration and authorization denials. even a little bit with documentation. Now, you may have to do some research on this to find out, what are common documentation problems and who are providers that may need training. But a lot of these can be resolved just through some training efforts within your organization, and it will yield a substantial return in terms of denials management. There are other things that you can do within the billing system itself. Now, I know a lot of billing systems have built-in transaction editing systems or claim scrub or work queues, work files, in order to catch these things before they go out. And common ones that you can see there are duplicate claim denials or issues with, say, coding. And if you can catch these before they're sent out and correct them, then that really gives you a great opportunity to keep these denials from occurring in the first place, which saves you a lot of hassle, saves you the whole rework cost, as well as providing payment so much faster than what you would see if those claims get denied. And then, of course, there are some times that you may have to go and work with your payers, and you can go and look into maybe bundling issues which are different or outside of what you see from the norm, or non-covered services that are really covered by pretty much everybody else, but there may be a couple of payers that are outliers. These are issues that can be addressed through payer negotiations, and sometimes you can find some returns that come from that as well. Well, we need to understand when we do this, though, too, that any return that we get when we are talking about denials has to be netted out over the cost that it takes us to go and recover them. And again, if we're using that $35 benchmark that's out there, then you can say, oh, it's great, we recovered these number of payments after the denial, but our net recovery rate from that then has to net out the cost it took us to get there. So really the key is, can we get these denials to stop occurring in the first place? So again, the questions that we're going to ask ourselves for strategic change within the organization that's there: is the problem significant? Now, there may be problems that we look at that people are complaining about, but it may not be even in the top 10 most significant problems within your organization. Understand what are the most significant problems that are there, and then you can set strategies around those. Understanding, can you control it? The fact of the matter is, a lot of times denials are flat out a function of volume within your organization. Your denial rates may go up. Your denial charges and volumes may go up, but that may be a function of you just billing more. What can you control to bring that back down in order to become a better performing organization from this standpoint? And again, what's the financial opportunity that's out there? What are the things that we can find that will really return the biggest? In this next dashboard, what we're going to look at is the ability of dashboards to do predictive modeling. And what we mean by predictive modeling is we can look at something like this activity that is in this dashboard, and we can see what's going on within the organization. We can see our denied counts and our charges. We can look at the recovery rates for denials that we're seeing, and we can see what our reimbursement rates for denied claims versus clean claims are. Once we know that activity, we can compare to scenarios of what we'd like to see, where we can look at, what's our clean claim reimbursement rate, what's it cost us to work a denial, and we can even do things within the dashboard itself to modify variables to make it, more appropriate for what we're trying to do. So once you have the activity and the comparison, what we're going to do is we're going to apply scenarios of what if we were able to perform better in a certain area? What if we were able to find a 5% reduction in denied rates? What would the cost savings of our rework be? What would the opportunity be in terms of getting the better reimbursement of what we're seeing? These what if scenarios are what allows us to identify outliers. And when we identify outliers, what we're looking at are what are the 20% of the providers, patients, locations, payers, whatever it is we're looking at, that provide us 80% of the financial opportunity. This allows us to focus our efforts in areas that are going to provide us the biggest bang for the buck and help us to better understand, where are we performing poorly, where are we performing well, and we know that those low-performing areas have the ability to perform as well as the high-performing areas as well. This allows us to look at what the anticipated financial return will be, which is a very compelling argument when you're trying to drive strategic change within your organization and when you're trying to set goals. So let's talk a little bit about strategic goal setting that's out there. You know, again, we're looking for what are the opportunities for improvement that will give us the biggest bang for the buck. Is it that we have held claims which are slowing down our cash flow? Are they held before the denial occurred in our editing system, or are they being held after the denial occurred? Again, what's it cost us to rework denials? Can we drive those costs down? And what's the probability that even with all of the work we put forth, we're going to get paid or we're not going to get paid? We have to really focus in on the efforts that we, through due diligence, have found will provide the highest likelihood of being paid. And then, of course, you know, how's that going to impact our overall collection rate? So what we can see here is that through the reporting and analytics that are available out there, we can formulate good strategies in our organization. And to just sum up, I'll talk about maybe a couple of different areas that we found through our clients that have helped them out and things that they were able to implement. And I've talked about this throughout the presentation, but identifying things that your practice or your organization is doing that sabotages your own denial. You know, what are some front-end issues that you have that are driving your denial rates, and can you put processes in place to fix those? When we're talking about the likelihood of getting paid, can we reallocate maybe our follow-up resources towards those follow-up tasks that are more likely to yield a payment upon appeal versus those that we know just probably are not likely to get paid upon appeal? And can we make it faster by, again, reallocating our resources that are out there? Do we have chronic payers that have outlying issues that we need to work with? Is there an issue where maybe even the cost of doing business with this payer is adverse to us to the point where we really need to address it with them? And again, are there things that we can do within the system that can prevent these denials from occurring to begin with? Are there services that we just know are not going to be paid no matter what we do, even if we think they should get paid? Can we create an edit or a tickler file to prevent those from going out, so at least we save ourselves the rework cost? And then we may even want to look at issues where we do get paid, but it may justify holding the claims a little bit longer on the front end in order to not have to have the denials on the back end. Something we look at here, a scenario that's common with us, we have a lot of children's hospitals with neonatal intensive care units. And a lot of times the children that are receiving those services, their parents haven't added them to their insurance until they get out of the NICU. And so in cases like that, it may be wise to hold on to those claims for a week or so to give the parents the ability to add the child to their insurance rather than sending it on and have a subscriber not found denial hit and sent right back to you. There are lots of strategies that we've hit, and again, every organization is different. These are just common ones that we've found, but I know that there are different opportunities within different organizations. And again, utilizing analytics to drive your reporting strategy is definitely worth the time and effort that comes from it. So Russ, I don't know if you want to talk a little bit about how analytics can really help drive the strategy.
Sure. So if I could touch base, you know, Scott, you've covered a lot of different material. I think it's been very useful. We also do have a lot of PDS customers on the line, and I do have some points to the PDS customers and some of the things that Scott showed that I'm going to highlight if you are a PDS customer as well. But if I could summarize some of the things, you know, some of the key things that come into play here when we blend, you know, the technology with the business content. You know, you need an analytical software package that's easy to use. It has to be visual, has to be very simple. That's a key driver. So having that to front end your denials is critical. You know, you need data that can be staged from the detail up, but also gives you the ability, you know, the term slice and dice, go from the top down. It has to be easy, and it certainly has to be fast. We touched on, and Scott showed some enhanced data modeling where we're matching the payments back to the charges. For those PDS customers, many of you know we call that our PDS advanced denials, but it's the ability to match the payments back to the charges. That's a function of data modeling. So if you're not familiar with PDS or you've never seen that type of capability, it's not enough to have the data coming from your system, just denials data. That requires data modeling, data staging, where the data can actually be matched, summarized, and then categorized, and then brought up into the analytics tool to make it easy and effective for management to work with. That's a key analytical capability, often overlooked. People think, well, I've got all my data, I can just put a reporting tool on top of it. You're not going to quite get the same results, and especially when it comes to so many impact points that denials have on the organization. Information, obviously, it has to be accessible, it has to be timely, and you need to be able to address short-term issues. So a tool set that doesn't react or allow you to understand what's going on quickly is not going to get you there. And that really ties into what we call flexible dashboards, which we showed a number of different reports. And I know one of the questions already came in. Are we going to have handouts? The answer is yes. We are just putting the information together so we can send everybody out both the presentation and the sample reports that we've showed today. So everybody who's attended will get a copy of those. But related to that, having flexible dashboards and then the ability to build dashboards literally in days or quickly where you notice a short-term issue, as well as having kind of the long-term information in dashboards that can address the management issues and can also communicate effectively. And a great example of that is many times, within the organization, a site manager, a location manager, may not always understand the complexity of what's going on in denial. So having a dashboard that can very quickly show, green checks and red X's like we showed today, or we're doing good or we're not doing good, or this is our target. We want to keep our denial rate below 10% and we're running at 15. So dashboards that can quickly focus the users who may not understand the complexity of the issue. And then, of course, making sure appropriate access to actionable data. And oftentimes, the financial analysts may have access to denials or the billing office may have access, but those others that are impacting the organization, again, front desk or even coding, may not have access to see dashboards, to see trends, or to even understand their role within a particular department. Those are all key things that analytics that will drive good strategy around denials. Most of these topics that I've just discussed really apply to many different aspects of practice management and healthcare. With that, I just want to summarize for those. We have a number of PDS customers on the line. Some of what we were showing, matching denials, that is our advanced denials capabilities. And I know from speaking to our customers, some of our clients are using that effectively, and there's some clients, either new clients or just a little confused. How do I take that and turn it actionable? One of the things that we've got planned, if you're a PDS customer, is the PDS workshops that we have. There's a workshop coming up at the end of the month. Scott will be leading that workshop. It will be much more hands-on, where he's actually going to break down the different denials, especially within our advanced denials and the tool sets, and walk you through using the data, using the tool to tie it together so you have a better understanding of how do I take advantage of that capability. A very powerful capability, very powerful when put into dashboards, but this is what I'd call a more advanced skill. We're using a unique staging that a lot of times people are a little confused. So we are going to drive more with our workshops. We were also about to announce, and this applies both to PDS customers, but even if you're not a PDS customer, we will be adding a consulting service where we can actually look at some of your data, and then come in and provide both hands-on training on the analytical tools, as well as point to some short-term issues, and where we'll be able to help focus your efforts and even build some actionable dashboards so that you can say, we're seeing these are the low-hanging fruit. As Scott mentioned, where's the 20% of the work that will get us 80% of the return on investment? And so that's something we're going to be offering both to PDS customers, but it will be something we'll also be able to offer if you're not a PDS customer, but you'd like to have us actually look at some of your data, organize it, and present it back to you to say, this is where you could improve, this is where we're seeing opportunities. So those are a couple of things that are going to be coming from PDS in the next month or so. Certainly if you're a PDS customer and you want to learn more, I strongly encourage you to attend the workshops. They're included with your support, and Scott will be leading that as well. So just a couple things on that. At this point, if there are questions from anybody in the audience, you can chat them in. We do have a rather large audience today. But if you have any specific questions that you wanted us to answer right now, right here at the end of the webinar, we will try to take a few questions. If you don't have questions, but you'd like to learn more about PDS, I put our contact information up on the screen, and we'll be certainly happy to speak with you. And of course, if you're a PDS customer, you're also always at any point able to contact support or reach out to us, and we will certainly work with to make sure we address the question. Oh, I think we have one question coming in. Is this a BI tool, and does it receive your information from the practice management system? So yes, we were showing the presentation and the analytics is one of the business intelligence tools. It's what we call PDS Empower. It's one of the many BI tools that we support, and the data is being pulled from the practice management system. We as a company, we also do work with denials data on the hospital or facility system if we have any hospitals with us at this point. We do support several tools, and we'd be happy to talk more about how you could have these capabilities and the different ways that we're able to deliver them with our customers. Okay. Scott, we have another question here. How do you track appeal effectiveness? Do you want to speak to that one?
Yes. So appeal effectiveness is a metric that can come from our advanced denials data staging that we do. What it allows us to do is to track by charge or by count, not just how much we got paid, but how of the charges that were denied, how much of those charges are, what's the count of the number of denials that had a payment on them of some sort. So we can look at appeal efficiency by just looking at the number of denied charges that had a payment against them, and then we can track and see what our collection rates were beyond that as well.
Good. Certainly, I think that question was asked by a PDS customer. Certainly we get you more information on that, or even these capabilities you may not be aware of that are within most of our customer systems that we've implemented in the last 5 or 6 years. This is a very powerful capability. I have a couple other questions then. Is an interface needed then to pull data? So if you're not a PDS customer, data does need to be pulled out of the practice management or the hospital system. And there's a number of different ways that we interface. PDS as a company, we've worked with over 25 or 30 practice management systems over the years. We do have experience pulling data out. The data could be as focused as just focusing in on denials and looking at whether there was a payment or adjustment or a write-off. So we can pull a very limited data set, or we could pull, if you will, all of your billing and appropriate transactional activity. So I'd be happy to talk with you more one-on-one. Different systems obviously require different approaches, but we have a lot of experience doing that for our customers. And again, if you're a PDS customer, certainly there's a lot of ways to reach out to us, but I do encourage you to attend the Advanced Denials workshop that Scott will be leading, and I believe it's just in 2 weeks from today. It's at the end of the month. You should have that information in the recent newsletter we sent out. It is also available on our website. If you're not a PDS customer and you'd like to learn more about any of these capabilities or any other capabilities that we have at PDS, which pretty much include all the expertise around revenue cycle reporting, patient access, looking at expense data, physician comp data, we're certainly happy to talk to you about that. I have another question here. Can you drill down to the claim from the report? And the answer to that question is yes. The way we work with denial data, we have to pull the detailed data, we roll it up, and through your analytics tools, then you can slice and dice and drill back down to detail. I think with that question there, we'll wrap up here. If anybody is interested or needs more information on anything, please don't hesitate to contact us. We really do appreciate your time and interest today on that. Again, thank you very much for joining us today. We appreciate your time. Have a great day.